If you're over 60, I want you to imagine something that happens every single day without a second thought. You turn the handle, the water warms, steam blossoms on the mirror. You step in to wash the day off. You feel fine, no chest pain, no headache, no warning. But by morning, your words are thick, your smile is uneven, or your right hand won't do what your brain is begging it to do. As a neurologist, I don't say this to scare you without reason. I say it because I've met too many older adults who looked healthy, walked daily, ate carefully, and still woke up to a life divided into a before and an after. The hidden trigger wasn't cigarettes or fast food, it was how and when they showered. Water is not just water when you're older. It is a stimulus to your blood vessels, your heart, your nerves, and the finely tuned baroreflex, your body's automatic pressure balancing system. Hot water makes the vessels in your skin open wide, like elastic bands pulled to their limit. Cold water snaps those bands tight. If you're 25 with springy arteries, your system tolerates the swing. If you're 70 with stiffer vessels, a slower baroreflex, and medication on board, those swings can mean drops in blood flow to the brain or sudden spikes that threaten fragile vessel walls. The shower becomes a stress test you didn't know you were taking. Let me start with a habit that feels wonderful but can quietly set the stage for a nighttime disaster: the very hot, very late shower. Heat draws blood to the skin and away from the central circulation. Your blood pressure drifts down. That effect is amplified in the evening because most older adults have a natural nocturnal dip. Blood pressure falls during sleep, and it's amplified again if you take diuretics or blood pressure pills at night. Add the mild dehydration that builds up across the day, and you've created a trifecta: thinner circulating volume, lower pressure, slower flow. In a younger body, that's a warm nap. In an older brain with narrowed arteries, it can be just enough to let platelets stick in a tight curve or to starve a vulnerable region for minutes that matter. I remember a retired mail carrier who swore by his 10 p.m. hot shower. He called it his pain medicine for sore knees. One evening he stepped out feeling unusually weak. He sat down, assuming it would pass. By morning, the right side of his body wouldn't listen. Imaging showed an ischemic stroke, blood flow blocked by a small clot in a previously narrowed artery. Did the shower cause it? No single thing causes a stroke. But the timing, late, hot, dehydrated, after antihypertensives, built the perfect conditions. That's the sober truth about stroke. It's almost always a collision between background risk and a momentary trigger. Another common trap is heading straight to the shower immediately after dinner or right after taking evening medications. Digestion is not passive. It reroutes blood to the stomach and intestines. In older adults, this postprandial shift can lower blood pressure, sometimes dramatically. If you then add hot water, another strong pull of blood toward the skin, you may find yourself lightheaded, your vision graying at the edges, or you may slide down the wall before you realize what's happening. That same combination can make sluggish flow inside hardened, plaque-lined vessels where clots like to start. If you also just took a blood pressure pill, the drop can be steeper and longer than your brain can tolerate. One of my patients, an organized retired teacher, timed her evening exactly: blood pressure pill, then shower, then bed. Efficient, she said, until the night she felt the room tilt as she rinsed her hair. She reached for the rail and missed. By the time her daughter reached her, words wouldn't form and her right arm was heavy and foreign. Her scans told the story we already suspected: a stroke likely fueled by low nighttime pressure, a recent meal drawing blood to the gut, medications relaxing her vessels, and shower heat finishing the job. Again, not one villain, but a dangerous team-up. The third mistake is bathing in a sealed, steamy bathroom for a long stretch. A small, heat-filled space doesn't use up the oxygen in any meaningful way. That's a myth. But it absolutely heats you, dilates your vessels, and can nudge your heart rate in either direction as your autonomic nervous system struggles to stabilize you. High humidity reduces your body's ability to cool itself through evaporation, so your core temperature creeps up. For older adults with stiff vessels and slower reflexes, that means more pooling of blood in the skin and legs, less return to the heart, and less forward flow to the brain. Add 5, 10, 15 minutes and the risk quietly increases: dizziness, a faint, a fall, or in the wrong person at the wrong time, the slow formation of a clot in a narrowed artery. There's also a mechanical risk here we don't talk about enough: the fall itself. The shower is hard, slick, and unforgiving. A faint in that space is far more dangerous than a faint in bed. I have cared for patients whose stroke was worsened by the trauma of hitting a fixture or who never made it out because the bathroom door was locked and help arrived too late. That's why I tell every older adult, ventilate the room, keep the door unlocked if you can, add a sturdy grab bar, non-slip mat, and if you've ever felt lightheaded in a shower, consider a shower chair. These are not signs of weakness, they are tools of independence. Then there's the cold shock trend. You've heard the promises: sharper mind, stronger heart, longer life. Brief cold exposure can be beneficial under controlled conditions. But when you are older, with arteries that don't relax and tighten as quickly, the sudden blast of cold triggers a powerful cold pressor response. Vessels clamp down, heart rate and blood pressure jump. If your vessels harbor plaques, those spikes increase mechanical stress on the arterial wall, especially in the neck and brain. I once treated a former firefighter who prided himself on toughness. After a week of cold morning showers, he collapsed with a facial droop and garbled speech minutes after turning off the tap. He survived, but he never regained the effortless clarity of conversation he once took for granted. Cold can invigorate the young, it can ambush the older. None of this means you must fear water. It means you must respect timing, temperature, and your own physiology. Age rewrites the rules. Your kidneys filter more slowly, so you dehydrate more easily. Your medications, diuretics, beta blockers, nitrates, ACE inhibitors, shift your hemodynamics in ways that are life-saving overall but can interact with heat, cold, and digestion. Your baroreceptors, the pressure sensors in your neck and chest, become less responsive, so your blood pressure can swing wider before your body notices and corrects. Even a small viral illness, a poor night's sleep, or a day of low fluid intake can tip you from fine to fragile in that small tiled room. Here is what I teach my own patients when they ask me how to shower without gambling with their brain. First, hydrate earlier in the day and take a few sips of water 15-30 minutes before you bathe. Not a huge glass at once. That can drop your sodium in some people, but a modest top-off so your circulation isn't running on fumes. Second, choose warm over hot and avoid sudden temperature swings. Start tepid. If you enjoy finishing cool, dial down slowly, not all at once. Third, ventilate. A bathroom fan or a cracked window helps your body regulate heat. Fourth, keep it brief. You are not earning extra relaxation by staying in longer. You're extending the hemodynamic stress. Fifth, time your shower away from heavy meals and away from medication peaks. If you take evening blood pressure meds, aim to shower at least an hour before or after and not right after dinner. If you insist on a nighttime shower, finish earlier in the evening and rehydrate afterward with a few sips of water, unless your doctor has told you to restrict fluids. Sixth, set the scene for safety. Non-slip mat, grab bars, nightlight, door unlocked. If balance is an issue, use a shower chair and handheld shower head. Seventh, stand up slowly, especially if you've been bending to wash your feet. Orthostatic drops in blood pressure are common with age, and the turn you made too fast is a story I hear again and again after a bathroom fall. I also ask people to listen for your body's whispers. Dizziness, a wave of nausea, dimming vision, palpitations, unusual weakness, a sudden sense that you need to sit. Those are not just old age. They are alarms. Turn off the water, sit, call out to someone if you can. If any sign of stroke appears, face drooping, arm weakness, slurred or jumbled speech, do not wait to see if it gets better. Call emergency services immediately. Minutes matter because brain cells die quickly without blood flow. The clot-busting window and other treatments are unforgiving. Let me answer a question I hear from older viewers. Doctor, are you saying my shower will give me a stroke? No. Strokes are complex. They come from years of risk factors: high blood pressure, diabetes, high cholesterol, atrial fibrillation, smoking history, sleep apnea, plus moments that tip the balance. The shower is one of those moments because it pushes on your system in multiple directions at once. Heat or cold, posture changes, humidity, dehydration, timing with food and medicine. If your brain's arteries are healthy and your pressure control is strong, a shower is simply a shower. If those arteries are narrowed and your pressure is poorly controlled, that same shower can be a stress test you didn't plan to take. There's a quieter menace worth mentioning, the myth that if I feel fine, I am fine. Many older adults have high blood pressure they cannot sense, stiff vessels they cannot feel, and post-meal drops they've come to accept as sleepy after dinner. Your brain cares about numbers you might never notice. That is why routine blood pressure checks at home, especially in the evening and the morning, are one of the most powerful tools you can use. If you see very low readings at night or big morning spikes, talk to your clinician. Medication timing can be adjusted, doses can be split, small changes close dangerous gaps. I also want you to understand how dehydration masquerades as normal aging. As we age, we lose a bit of the thirst signal, and kidneys conserve less water overnight. A day with little drinking, a salty dinner, a pill that pulls fluid, and a hot shower at 10 p.m. That is the sequence I can sketch in my sleep because I've heard it so many times. The antidote is mundane and effective. Steady fluids across the day, not all at once. A glass of water with dinner. And, for many, avoiding very late showers altogether. Your brain would rather you be a little less relaxed at 10:30 p.m. than a little more vulnerable at 2 a.m. What about the supposed brain boost from ending cold? If you enjoy a gentle, cool finish and you have well-controlled blood pressure, take a gradual approach. Notch the temperature down over 30-60 seconds, not instantly. Keep your head out of the direct stream at first. Breathe steadily to avoid a gas-triggered spike. If you have coronary disease, significant carotid narrowing, a history of TIAs, uncontrolled high blood pressure, or you simply feel off when cold hits you, skip it. There are safer ways to feel alert in the morning. Light exposure, a short walk, a glass of water, without provoking your vessels. Many viewers also ask me whether steam rooms and hot tubs carry the same concerns. The short answer is yes, and then some. Immersion heat can drop your pressure further and faster. Confined, humid spaces make it harder for your body to shed heat. If your heart struggles with volume changes or your pressure runs low, that blissful soak can turn treacherous. If you insist on using them, keep sessions short, hydrate, never go alone, and avoid them late at night or right after eating or taking medications that relax blood vessels. There is hope in all of this, and it is practical. I have watched older adults who were having near-faint episodes in the shower go months and years without a single incident simply by moving their shower to earlier in the evening, trimming the temperature and spacing it away from meals and pills. I have watched blood pressure logs stabilize with small timing changes. I have watched people reclaim confidence once they added a grab bar and stopped locking the bathroom door. Prevention is not glamorous, but it is the quiet hero of brain health. If you take nothing else from me today, take this. Your independence rests on thousands of small choices. Most strokes are not bolts from the blue. They are the final straw in a stack we build every day without noticing. You cannot change your age, your genetics, or your past blood pressure. You can change tonight's shower. You can change when you take your pills. You can drink water before you step into the steam. You can decide not to imitate the cold plunges that make sense for a 25-year-old athlete and make no sense for a body that has served you for 7 decades. And if you've already had a warning, what we call a TIA, a transient ischemic attack, or a mini-stroke, your margin of safety is thinner. Please speak with your clinician about medication timing, blood pressure targets, antiplatelet therapy if appropriate, and the safest routine for bathing. Put a printed fast checklist near your bathroom mirror as a reminder to everyone in the house. Practice saying face, arm, speech, time, so you never hesitate if the moment comes. Teach your family to unlock the bathroom door first, then call for help. Seconds become minutes. Minutes become outcomes. I wish I could show you all the faces I've met, kind, stubborn, funny, quiet, who thought a shower was only a shower. I wish I could rewind their nights and give them 15 cooler degrees, 60 minutes of spacing after dinner, a handful of sips of water, a shorter stay in the steam. I cannot, but I can offer you this map. Use it. Keep the water warm, not scorching. Keep the visit short, not lingering. Keep the room ventilated, not sealed. Keep the timing smart. Away from heavy meals and medicine peaks. Keep a hand on the rail. Keep your future in focus. This is not fear for fear's sake. This is respect for a brain that has carried you through decades and deserves a little planning to carry you through many more. Tonight, when you reach for that handle, I want you to hear my voice and the voices of every patient who has sat across from me after a night that changed everything. Make the safer choice. You will never know the disaster you prevented, and that is exactly the point. Disclaimer: this video is for general information and education. It does not diagnose, treat, or replace your personal medical care. Always talk to your own doctor about your medications, blood pressure targets, and the safest routine for you, especially if you've had dizziness, fainting, TIAs, heart disease, or poorly controlled hypertension. If you notice any stroke symptoms, face drooping, arm weakness, speech problems, call emergency services immediately.